Part 1, Being Any Patient. Chapter 1, You Are More Than Your Diagnosis. Real Stories, the Good. The doctor came in and asked me what brought me to the ER. I explained I was having a flare-up of my LPSH and my home meds were not effective or staying down. While the provider was speaking to me, a nurse came into the room and began by asking questions of me in an accusatory fashion. Where were my narcotics? Did I run out? Why was I sweating/pacing? Was I withdrawing? The provider quickly interrupted the nurse and explained to her that he had already spoken with my doctor and seen my chart and that I was in serious pain. As they left the room, I could hear the doctor in the hall telling the nurse to access my port and he would be putting orders in. He went on to tell her that this is important to give every patient the benefit of the doubt when it came to pain. He said to her, I'd rather treat 100 drug seekers than miss one legitimate patient. Very refreshing. MC from Connecticut. If I were to ask you to tell me about yourself, speaking as a healthcare provider, you would begin to list the myriad of medical problems that you have. While every single item on the list is important for me to understand where you are, none of the items on the list define who you are. Our current medical delivery system has treated you so impersonally that you've forgotten this basic fact. You are not fibromyalgia, EDS, heart failure, bipolar, ankylosing spondylosis, stroke victim, migraine sufferer, or any of the thousands of terms we use to describe what is going on inside your body. You are more. You will remember that when I first said these words, I was subjected to open hostility. It took me a long time to adjust and understand why this simple phrase could generate such a strong response. The simple truth is that my statement flies directly in the face of every message that the healthcare system gives you. When you interact with them, every message tells you that you're all alone. In your electronic health record, you are known by a wonderfully archaic paradigm known as the problem list. This is a list that never truly gets updated. Issues go on the list, but never come off, even issues that got better. We keep this list long and descriptive, and it's partly because we don't want to forget something that may have happened in the past that may affect your health now. Still, the way we use it does not serve any function except to label you as a problem, which I say again, you are not. The problem list, while well-intended, does not account for the fact that you are a dynamic, living creature, and that some historic problems are no longer relevant. We, as healthcare providers, love this list. We call it the healthcare snapshot. But it really is only a problem snapshot. Once it's more than 20 items long, the only message the provider sees while looking at the list is, this one's going to be trouble. We love to cut and paste your problem list into every note we generate without looking critically to see what may have resolved or is so well controlled it is no longer part of who you are. The list is so archaic. I've often fantasized about inserting randomly into a patient's problem list. Number 15, cooties. Just to see, because I would love to see how many times this fictional diagnosis would get perpetrated in future notes. I'm almost certain it would be years before anybody would pick up or question its presence. And just because I have ADHD, this is a good time as any to say you're not your allergy list either. Many of the items on your allergy list exist because when the medication was prescribed, not enough of a conversation took place about what to expect, what side effects were possible, and what was the specific goal of prescribing that medication to you. I'm not questioning your allergies, but I am saying that many of your medication failures are due to failures to set specific expectations. I'm saying that again. I'm not saying that I question your allergies. I'm saying that many of your medication failures are due to failures to set specific expectations. But back to the main point. The system makes you feel like a problem. Many of you also find yourself a problem. You are dealing with real medical issues that cause you to function differently than you perceive others to function. Your chronic health problems are holding you back in your mind, and yes, also in reality. I understand this is true, but where things take a decidedly wrong turn is when your brain concocts the idea that you are somehow worth less than others. Yeah, I separated those two words with strong intentionality. No matter what else we might agree or disagree on, there's one word I will fight you over. You are not worthless. See, I can almost hear you screaming, Dr. Mike, you don't know what I'm going through. Valid. Accepted. I don't. But one thing I know for a fact, you are not the person that evil, cruel brain of yours says you are. See, I know a little bit about that evil brain and how it seeks to destroy your self-worth, especially if you're not 100% medically whole. I know how forces will take simple facts and turn them into curses upon yourself. But I'm here to declare something. You are worth every trouble that you perceive you cause others, just as you have never entertained the thought that the people you love might be a burden to you. You are more. The beginning of taking back self-control of your life and of your medical care comes with this basic understanding. I do not know what you have been through. I imagine I'd be horrified. I've seen a lot of horror, and I'm not immune to the horror now. I remain affected by your horror. Being in your skin is a traumatic place to be. I accept that. Yet your intrinsic worth remains to me and to all who love you. People have tried hard to erase this fact in your life. Perhaps not as much as your own brain, but outside invalidation of your self-worth, it occurs daily. This too does not define you. I will go ahead and say his name here because I will be unable to avoid it for all the pages that I write. I intend to write. But Jesus, he declares you worthy. If you are atheist or agnostic or another belief system, just know that I see you. But you should still know that your intrinsic worth extends beyond what others think of you. See, I have severe lumbar spondylosis, ADHD, moderate chronic depression and anxiety, a poor self-image, issues with anger and control, 2 hernia repairs, an appendectomy, and quite frankly, I may be autistic and a complete butthole. But none of that defines me. What defines me is that despite all of that, I know how to see others, and I help myself by pouring myself into their lives. At some point, you may have begun to feel that you have nothing to offer anyone else. And I can tell you that if you're breathing in and out, you're everything someone else needs. We just need to discover who and what. You are more. It is very likely this will be a repeating theme through the rest of this book. I can see myself taking the time to stop often and just repeat it, like some sort of validation we speak into the mirror. I have a lot of negative self-talk to overcome. And I am not above laying it on thick to do exactly that. You are more. You are more. You are more. Meditate on that today. I love y'all, no buts. Copyrighted material, please respect it.